Gonorrhea by Edwina White. Gonorrhea is a STI, sexually transmitted infection. Gonorrhea gets its name from a bacteria, Neisseria gonorrhoeae. Where does this bacteria live? This bacteria lives in warm, moist areas in the body, like the vagina, the anus, the eyes, urethra, female reproductive tract, cervix, uterus, fallopian tubes, male reproductive tract, and the throat. Who does gonorrhea affect? Anyone who is sexually active, male, female, or babies of infected mothers. Highest infection rates are in the age group of 15 to 24. How do I get gonorrhea? Gonorrhea is spread during unprotected contact with someone who is infected. It does not always have to be a sexual contact in order to be infected. Infection can occur by touching an infected body part, penis, vagina, mouth, or anus, or unclean objects. Passed to babies during delivery from an infected mother, multiple sex partners without protection. Symptoms. Symptoms are very different between males and females. Symptoms in males. Most symptoms surface 1 week after transmission. Some men don't have any symptoms at all and it can go undetected for some time. Symptoms in males are pain and swelling over the foreskin, pain in the testicles, swollen testicles, painful and burning sensation during urination, discharge from the penis, which could be white, yellow, or greenish, smelly discharge, sore throat, and an urgency or frequency to urinate. Symptoms in females. Some females have no symptoms at all. If symptoms show, they show between 2 to 14 days after transmission or longer. Symptoms are mild and often mistaken for a vaginal infection or a bladder infection, which makes it even harder to diagnose. And the main difference between males and females is the length of the urethra. Majority of the time, women will see symptoms faster than men because our urethra is so much shorter than a male's urethra. Symptoms in females are the urgency or frequency to urinate, having heavier menstruals or periods or spotting in between cycles, bleeding after sex, pain during intercourse, sore throat, painful and burning during urination, discharge from the vagina, which could be watery, creamy, green, yellow. The discharge may also be smelly, which is another symptom, fever, and sharp abdomen pain. Symptoms in other areas of the body, within the rectum, there could be painful bowel movements, pus-like discharge, anal itching, bright red spots of blood on the toilet paper. Within the eyes, you can have general eye pain, pus-like discharge, and have sensitivity to light. Symptoms in other areas of the body, throat, sore throat, swollen lymph nodes in the neck. In the joints, it could be septic arthritis, which could be, the signs of that is red, warm, swollen, and extremely painful at the joints. When to get tested. If you think you have gonorrhea, when you notice signs or symptoms that are abnormal, when someone you've been in contact with sexually with tells you of a positive result or things that they are infected, unprotected sex with a new partner, if you or your partner has had unprotected sex with other people. The diagnosis and the testing is very simple. It's a swab from the vagina, the cervix, the throat, rectum, eyes, or urethra, one of those, or a urine sample, which is the most easiest way. The treatment, antibiotics for 7 days, and no sex for 7 days during that medication to prevent from reinfecting. Complications of untreated condition. It can cause infertility in men and in women. Within men, it can cause the tube to coil in the testes, and it becomes inflamed, which causes infertility. Scarring in a urethra, painful abscess in the interior of the penis that causes infertility as well. Infertility in women, PID, which is pelvic inflammatory disease, which causes scarring in the fallopian tubes. Pregnancy complications. Ectopic pregnancy is a pregnancy that occurs outside of the uterus, outside of the fallopian tubes. Long-term pelvic abdominal pain. Complications of untreated condition could also increase the risk of HIV and AIDS. Patients having gonorrhea are more susceptible to contracting HIVs or AIDS. Having both makes it readily to pass to partners. Complication in babies, it could cause blindness, sore on the scalp, or infection. And of course, the infection of the joints and other areas, which are symptoms of fever, joint pain, skin sores, rash, swelling, stiffness, bloodstream, heart valve damage, inflammation of the lining of the brain or spinal cord. Prevention. Abstain for sex. Use condoms. To be involved in a long-term monogamous relationship. Get tested regularly. Don't have sex with someone whom you suspect is infected. Prognosis. Gonorrhea is curable. And here are a list of references. Thank you for your time.